We are happy that over the years, our partnership with Safaricom Foundation has benefited the people of this county. And it's a partnership which we want to strengthen. It's one which we appreciate, and it's one which we believe will continue to benefit our people. As you are told, the statistics are not very encouraging for this diabetes, especially diabetes among children. The statistics are not very encouraging. You have heard that out of 2,000 people who are screened, 450, among the children, 450 of them are positive. That is a rate of almost 22%. I think that is a very serious matter. I cannot imagine. I know diabetes is a lifestyle disease. It's a disease based on maybe diet and other lifestyle activities. But the prevalence among young children, I think it's absolutely nothing to do with lifestyle. So it's one which we will encourage. Maybe there should be more research to find out what is it that is causing this diabetes among these children. Somebody just gave me a note and said that it has been researched that spaghetti is one of the things which causes diabetes in the communities here. But I can assure you that no child eats spaghetti. Therefore, that cannot be the reason. And even spaghetti is not a staple diet in the communities here, although people eat it. So I think there must be a very serious underlying reason why this disease is that prevalent in these communities. I'm happy that there has been civic education and sensitization. 50,000 people who have been mentioned as having been educated on diabetes, and the opportunities available to avoid it is very encouraging. But we want more sensitization. We want our doctors and our health workers to go and inform our people on what they know are the causes of this disease so that we can avoid it. Secondly, you are aware that we are building a very ambitious cancer facility just in about 200 meters from here. Cancer is another killer disease in this county. The prevalence is much higher than the national average. And we have no reason so far to understand why the prevalence of cancer is so much in this county. Certain explanations have been given. A regional one, people say that, used to say that some nuclear waste has been buried in this region in the 80s. It has contaminated our water sources and the pastures. I don't know how true that is. Others have said maybe it's the food which we buy from the refugee camps. And the food, on average, is much cheaper than the rest of Kenya because of the subsidized food we get from refugees who sell what they are given for free. I'm not very sure whether that is true also. But whatever the reason, cancer remains, especially cancer of the esophagus, remains a major problem in this county and in this region. Finally, you know that our hospital is facing challenges of facilities, of services, which should not be there. We are investing in this hospital. We will upgrade the facilities. We will invest more in medicines and other disposables. Our health sectors, especially our consultants, have not been very committed to their work. We have almost 60 doctors who have gone abroad to study, whom we are paying. Maybe we need to do something about it. It's very high cost. Unfortunately, some of them who have even come back have not come back to this hospital. We are paying them, we educated them, we give them paid leave. But when they came back, I'm told they're hiding and working for themselves while they're earning from us. The board is not in place. I mean the management board. We are going to create one. But let me assure you that we are going to change to have very serious transformation in our health sector, because there are many things which are wrong.
We last came here in April of 2019, and during that occasion, we launched a child-friendly program for diabetes. Over the last year and a half, we've been doing this project, which we will launch shortly, and this project is geared towards creating and enhancing a program that will help support diabetes management in children. Last year and a half, Your Excellency, we've been able to do screening for diabetes. That exercise has covered 2,000 children. Slightly over 450 of the 2,000 have been found to be diabetes positive. This is a very high rate, Your Excellency, and is therefore right to conclude that diabetes is prevalent in this area. Of the 450 children who we have identified through screening, Your Excellency, all of them, I'd like to assure you, are in the diabetes management program. 320 of them have now been taught and have been made aware of diabetes management practices, which includes proper doses of insulin, as well as syringes. Your Excellency, sir, over that period, we have invested in other things as well. In order to address diabetes, you don't just need to screen, you need to do other things. Among the things that we've done, Your Excellency, is the setup of community health care workers so that we can give support to the diabetes ecosystem. Over that period as well, we have registered over 100 homes to NHIF. We intend over the months that are coming to add another 150 so that we complete the health ecosystem, Your Excellency. Nationally, Your Excellency, it is estimated that about 500,000 Kenyans have diabetes. Unfortunately, only 40% are aware. 60% are not aware that they have diabetes. Your Excellency, therefore, our biggest success in this program has been creating awareness. Over the last year and a half, we have contacted at least 50,000 residents of your county, engaged them, created awareness, and they now know. It is encouraging that the 450 children that are in the program now know their status and are able to take care of themselves. Safaricom Foundation has spent 500 million shillings in the health sector because we are passionate about the health of Kenyans, because we are about transforming lives. We have invested over 500 million in the health sector. And this is something that we will continue to do as we pursue our agenda of transforming lives.